Welcome to our session on how we scale the patient support services at IQVIA using Databricks. I am quickly going to flash the forward-looking statement. I'm sure you've seen this from the morning. Please do read through it. I think there's a test at the end of all of these sessions. So definitely. Let's jump right in. Scaling patient support services, how and why we did it with Databricks. As you see here, we have IQVIA and our partner, Customertimes. I do want to introduce our team. My name is Sudha Ragataman. I have been in the data world, swimming across various lanes for the past 2 decades. I have Laura Still on my team, who is an Associate Director of Data Platform and Business Intelligence Operations. I have Dimitro Kobrin, who is the Head of Data and Digital Engineering at Customertimes. And then we have George, who is the data engineer for this initiative. He's flown 5,665 miles to be at the summit. And this is, and this is his first time in the USA. So welcome, Georgie. Thanks. So I do want to talk about, scaling patient support services. A project of this caliber or an initiative of this caliber definitely requires a tech village. It's not just the 4 of us. So I do want to talk about, the partnership between IQVIA and CT. We joined forces about a decade ago to launch and operate a patient support program for a leading pharmaceutical company. As you see, it's not just the tech services that runs an initiative like this. You can see the core services that are offered on the bottom between the 2 companies. This is very important to have all of these pillars in place for an initiative of this caliber to take off and be operational. Now that you've heard me say patient support services multiple times, I am sure you're wondering and being curious about what is this? Our team is very proud and honored to support a national nurse-led program that empowers, educates, and changes life. As you see, we empower individuals to take control of their health by being in their life every step of their medication journey. We teach them how to use it, we teach them about their disease, and we explain to them everything that they need to be successful in the journey that they're traveling in. Over the past decade, we are very proud to have supported over 1 million patients. You can see our values. We are truly aligned to giving them the best value they can get out of their life, being transparent, having respect, and showing relentless improvement throughout the journey of patient support services in the many lives of these patients. Now, this is a wonderful story, right? This is a great program. I introduced you to the team, who is fabulous. Why are we here, right? Every good story has a villain, if you see. What is our villain? I think we grew too quickly, and we struggled to scale. All this great program would run fabulous, but then at some point, we outgrew our house. Now, I would like to introduce Laura Still to tell us more about it, because she is the closest to this program, and she's going to tell you how.
Thank you. So as Sudha mentioned, I have had a full circle of a career path. I was in IT, working with many pharmaceutical companies for most of my career. Y2K sent me running out of IT and over to school to become a registered nurse. And then I became a nurse ambassador with this really cool patient support program. It started out in 2013. And I remember the first patient that I spoke to, the fear, the lack of hope, the confusion. They had a new diagnosis. The doctor told them all about it in 34 seconds at the doctor's office. They had a prescription they had to fill. It had to go through a specialty pharmacy. They didn't know if their insurance company was going to approve it, and they were on their own. Figure it out. Go ahead. It was a nurse's dream job. And then, as most full circles will do, I ended up over on the data side. because one of the most important things that I do now in my day-to-day is translate what's going on for the patients, for the nurses supporting them, for the business that employs them and pays all for this support, so that the data team can really support them. So, how did we get there? After supporting patients for 7 years, I became part of the data team, and what we saw was, Sudha's absolutely right. We had hit stumbling blocks, and we had to figure out, how do we get from this rapidly growing program over to having the right data where we need it and when we need it? Well, the nurse experience was fractured and sometimes embarrassing. We had systems supporting these patients for their insurance approval, for their prescription, for all of the things that they may need, but we didn't have access to all the systems ourselves. So we were almost having to have the patient be the intermediary. Tell me, what updates do you have on your prescription? Have you heard from your insurance company? And they'd say, well, don't you work for the team that's helping on that? I do, but we don't have access to their system. So we needed to be able to get our hands on that data so we could support the patient. What that led to was our enrollments were rising. We were expanding the program with tools, helping the patient in all of the ways that we found there were gaps. We saw they were alone. We found ways to support them. But we had, as Sudha said, outgrown the house that we built. So I'm going to introduce to you my partner, and let me tell you, he helped me do this in many ways. George from Customertimes is the lead architect. I call him a magician. He's a calming force, and he's going to tell you things that I couldn't even start to explain, and how he changed patients' lives, how our team changed patients' lives. George?
Thanks a lot, Laura.
Yeah.
Hello, everyone. My name is George, and I'm really excited to be here. And I would like to share with you our story, how we deployed and developed our new data platform. Let's start from the beginning. So we came to the point when our existing requirements, our existing data platform doesn't meet our business requirements. Let's start from the scalability. Our previous solution, based on relation database system, hits its fundamental scaling limit. Adding new data sources, new processes requires scaling the entire platform. Scaling problems bring us another capacity constraints. ETL processes, analytical queries started affecting each other. When one ran efficiently, others suffer. Even worse, we couldn't onboard our new analytical users, since our platform couldn't handle growing concurrent queries or diverse workloads. But scalability was only part of the story. Our platform completely blocked advanced analytic capabilities. Predictive analytics, machine learning, sophisticated analytical methods, they were simply impossible on our platform since it wasn't designed to handle these workloads. For the cost management, further infrastructure growth would double our costs. We needed incremental scaling, but not incremental growth. At the same time, we need to preserve, At the same time, we need to preserve our existing investments by lifting and shifting or incremental refactor our existing pipelines. From architecture perspective, we need to be sure that future requirements changes would not initiate catastrophic migrations. We learned on our experience that being blocked in proprietary solutions creates the long-term risks. Adding another level of complexity. Operating in regulated environments like ours meant that compliance is non-negotiable. But we still need compliant data handling without sacrificing our operational assets. When we step back and take a look at all these issues together, we realize that they are fundamental architecture constraints that approach couldn't resolve. And we need a new platform built on core principles of scalability, analytical maturity, compliance, cost efficiency to ensure our future growth and innovations. After analyzing multiple platforms, we come to the decision that Databricks is the right solution for us. Let me explain why. First, compliance. Azure and Databricks shared responsibility model, encryption, compliance profiles gave us exactly what we needed. Unity Catalog provides us flexible role-based access model. That means that we can restrict access to sensitive data while still maintaining our operations. What's more, Databricks built on open source foundation. And this was huge for us because our DBT processes, our Salesforce data ingestion framework, we shouldn't start it from scratch. Databricks also works on open storage formats like Delta Lake out of the box, plus any Apache Spark support language formats. We can scale our existing clusters or spin up entirely new one based on our workflow demands. Our analytical users can provision their own clusters without affecting workloads. The queries that took hours in the past, now they run in the minutes. Also, Apache Spark can process both structural and unstructured data. And at the same time, we can develop our own processor for specialized formats. For complex analytical requests, we still have options. Tasks that couldn't be solved with SQL, we solve with Python and Scala. And this gives us flexibility across all complexity spectrum. At the same time, Databricks has built-in toolset for developing machine learning models, serving and integrated with MLflow. That means that we can develop, operate, and maintain everything right within the platform. And from the cost management, Databricks pay-as-you-go compute model gave us predictable forecasting for the cost of infrastructure. And decoupled compute and storage based on basic cloud services provide us the ability to optimize our solution without vendor lock-in. Next, I would like to tell you how we approached our migration to minimize our risk and ensure success. And here's something important. Our migration didn't actually start with Databricks. It started with refactoring all our ETL pipelines and writing new one using DBT. And it was a crucial strategic decision that made everything else possible. By structuring our processes with DBT, we achieved two important milestones. First, we decoupled our business logic from infrastructure that made it portable across all the platforms. The second one, we received the consistent version control approach for developing workloads. And our development team could easily understand and maintain. Let's think for a moment just what it means. Once all your processes properly structured with DBT, the migration to Databricks became much more straightforward. We should not focus on rewriting complex analytical logic when we can focus on our new platform, configure CI/CD, MLOps pipeline, and planning future initiatives like enable data sharing capabilities. This approach significantly reduced our risk complexity since we was not trying to solve everything at once. Let me right now explain how our solution works and how everything tied together. We built our foundation on Terraform that we're using for infrastructure provisioning and providing access to our users. This code-based approach gives us consistent, repeatable deployment with proper security configuration baked in right from the beginning. Salesforce serves our main data source containing all our core program data. And to handle it, we developed our own framework, especially for the Salesforce, utilizing different APIs for effective data handling, load the data to our system. And at the part of this migration, we adopted this framework to run Apache Spark that increases performance and scalability. Once data is loaded, it's landed in our bronze layer. Here we perform simple but really important data checks like strict hammer enforcement, data type checks, referential integrity validation that give us data quality right from the beginning of our pipeline. After validation, the data splits into two streams in our silver layer. First stream contains sensitive data and remains in the restricted environment. That data is used for regulated operational reports. The second stream contains de-identified data and used for general reporting and machine learning workflows. Then this data feed to our gold layer, where we're preparing data mart for reporting needs, and where we're maintaining our self-service layer that our analytical team use for preparing dashboards, reports, running ad hoc queries, and exploratory data analysis. Then the result of the analytics flow back to the business into two main ways. First, with the BI tools, where business users can come and check reports and dashboards. The second, certain analytical results directly push back to the Salesforce itself. You may wonder why we need Airflow when Databricks has its own workflow capabilities. The answer is architectural. Our solution is designed to have multiple workspaces, and we need one place to coordinate all processes between them. In other words, Airflow plays the role of centralized scaler within our platform. And tying all this together, Unity Catalog that plays the central role in our data governance strategy. We are using one Unity Catalog for all our workspaces. This gives us several benefits. First, we can control access to all our data assets from one place. The second one, our analytical users can restore all the lineage all the way back to the landing layer. It doesn't matter in which workspace you're working in. And this significantly increases transmissibility of all solutions and helps really with troubleshooting. This infrastructure gave us scalability to solve increased data volumes, flexibility to work with different analytical requests, and governance controls we needed in our solution. I'm excited to share with you a result that we achieved with our platform. First, the migration was seamless to our end users. By decoupling business logic from infrastructure, we moved to the new platform without any downtime. That works for our business continuity and increase the trust in our data system. After the migration of our new framework to the Databricks, we significantly improved our data refresh capabilities. If in the past it was like 2-3 times a day for data update, right now it's 6 times, and we would like to increase it. Also, we totally removed the overall limitation of number of self-service objects that can be used in analytics. With Databricks data governance tools, we developed our role-based access model that significantly decreased time that needed to provide access for our users to the data they need. At the same time, Unity Catalog changed how we approach the new business request. When we receive the business requirements, our analytical team can check what data we have, where is it located, and how they can use this data to solve this issue. This significantly decreased time for preparing the requirements and working on new initiatives. And the most important, right now we have advanced analytic capabilities with analysis in our platform that we haven't had before. And shortly after the migration, we deployed machine learning models that provide useful insights to our CRM users. From the cost management, right now we can easily understand how much it will cost to add new data source, to increase frequency, or to add new workflow, and made the decision based on business value versus cost. All these achievements, they are not just technical. They are directly connected with the business value. More frequent update to timely decisions. Proper governance, reduced time to value. Advanced analytic capabilities gave us new possibilities how we can optimize our program. And all these achievements ensures our investment and face us to continuous growth. And maybe you have questioned how it's translated to the business impact. Here I pass my word to Sudha.
Thank you, George. As you heard from George, right, you've learned about the problem that we had, the solution that we put in place. You know, you can see the technical impact that George had brought together. There's one more challenge, though, that every data team has to go through. We have to be able to translate all of this to the business. So no business impact, then we really didn't innovate, right? They have to feel the impact. So let's put some simple translation here on what they would see, right? Now that there's lightning fast queries and lean pipelines, what does that mean to them, right? Visible improvement in performance, right? The slowness that they experienced before is no longer there. I think we're able to get things done faster. The empowered decision-making, the self-service analytics is a quick win, right? They're able to go in there and do some analytics on their own without having to depend on anybody. That's the biggest win that the business could ask for, right? And then we move forward to provide them the answers while the question is there, hot and heavy, right? As they have a question, our data is enabling us to answer those questions right away. Streamlined tech footprint, everybody's favorite impact, financial impact. Easy to explain to the business and business's favorite impact, right? Road to AI-powered capacity and orchestration, like George mentioned, everybody wants to move towards AI, right? How are we scaling to support our patients to move forward, future insight, right? Does our platform help us to move our patients there, to make the experiences that they have better? So Databricks has definitely helped us get there, right, with what we have seen. Last but not least, we have data governance and compliance. Being in healthcare, we have the responsibility of adhering to the strict guidelines, right? We need a platform that will help us stay within the boundaries while we help the patients, so it takes the thinking outside of the pieces, right? So definitely a big gain, if you see, in terms of business impact of where we were at when we weren't able to scale to. After we scaled, we saw immediate impact on every single pain points that we had. Now that we've seen the problem, the solution, we've seen business impact, but what started all of this? Why did we embark on this journey? Because of the user experience, right? What kind of impact do we have in terms of the user experience? I'm now going to call on my favorite nurse ambassador, Laura, to tell me what she saw in terms of the user experience.
Yes.
Thank you, Laura.
Thank you, Sudha. So there really is no stronger evidence that technology is a catalyst for change and how we think than when you think about data. If you haven't read Sherry Turkle's book, I think it's called The Second Self, it's a must read. But in my lifetime alone, data has changed the way we do business. And in our case, it's changed the way we support patients. So because of the change we made, patients know we collaborate with our internal and external partners to support them. Because of the changes we made, the nurse ambassadors know they have the data they need in order to support the patients. The pre-call planning doesn't take 5 different logins to 5 different systems anymore. You open our system, and what you need before you call that patient is right there at their fingertips. Because of the change we made, the business has access to insights. They can connect the dots to help them understand the patient journey, the nurse's journey, and what we can do to improve. So my final message to each of you, before I hand you off to Dimitra, who's going to talk about lessons we learned, is you don't need to be a nurse to change patients' lives. You can be an architect. You can be director of data governance and data. You can be in charge of digital engineering. You can be QA. You can be DevOps, developer, all of it. Because that's what we did here. These changes are changing patients' lives. And I'll hand it over to Dimitra.
Thanks, everyone. Thanks, Laura. I guess the most important part that I would like to talk about today is our lessons learned. What it takes to enroll a huge patient engagement platform to multi-billion organization supporting millions of patients and to actually change the world a little bit. It's not easy, let's be honest. So we definitely would like our experience to be populated through whoever makes at the beginning of the decision to enroll the patient engagement data hub or facing the challenges of enrolling the data hub for themselves or in the further steps of those journeys. So we would like our experience to be shared because this is what makes us valuable and this is what the summit is about, to share experience and trying to avoid ups and downs that we were facing previously. So multiple times during our sessions, you heard about change enablement is important. From my perspective and from my point of view, together with IQVIA and as a partner from a consulting organization, right now it's critical. Why it's critical? Because everyone in the team is supposed to be aware about the capabilities and capacity of the platform. What can be done over there? Unfortunately, there is no option that separate member of the team can sit in the bubble and right now say, I'm responsible only for calling patients. I'm responsible for fulfilling the forms. I'm data engineer fulfilling the lines of code. I'm data analyst to structurize and map data, because this is not how it works. To enable the real power of the platform, you're supposed to understand the platform. And the people who are working on the platform are supposed to understand each other. That's why, I guess, the platform is supposed to be transparent for everyone. The other part that we are thinking could be crucially important, 5-10 years ago, we were building the platforms with a North Star architecture approach, I guess. So we were sitting in the room for multiple months, creating something that will be good for next 3, 5, 7 years, and will be the fundamental for our program. World change. You cannot do it anymore. I guess everyone in this room and everyone who is attending the summit understand that the world is changing significantly, and the speed of this changing is exponential. So right now, be prepared to build your platform with the availability to change on the quarterly, monthly, and sometimes daily basis. Because this is what business and this is what impact are driving us through. Tomorrow, the regulator will change a decision how you can communicate and interact with a patient. Tomorrow, in Europe, the government will change a GDPR policy a little bit. FDA will create a new rules of HIPAA protection around your data, and you need to understand you will be facing those challenges recently, and you need to be prepared for them. There is no way you can build the platform and sit with this platform for multiple years and just be successful. The other important things is flexibility. This is what I mentioned previously with be prepared to changes, but also you need to be flexible in any type of decision making. We are facing a lot of demand from the stakeholders, internal, external one, but we as a team are trying to process those changes in the way of what actually bringing the value and how we can execute this value in a quickest possible way. So the classical approach of fulfilling the backlog of tasks is not working anymore because what was said previously. So the other important part is how to make the team sure that they are bringing value. In our particular use case, the significant change of the mindset of developers or whoever was determined as a technical experts from both sides was that they are working with people's life on each day. So any line of code can impact someone's life and can impact it significantly. The value of the code, the value of the deployment, the value of each quality test deployed inside the Databricks platform is affecting someone's life. So bringing this transparent information to the developers are increasing the value of what they are doing for themselves, and they are ready to contribute much more because they see the result of their work, which unfortunately not so recently for us with what we are doing as IT experts. Then the way to the patient is a little bit more far. But it works vice versa. Laura starts, with all the respect to her, she's amazing, I love her, but 2 years we met, I was like, what is iceberg? Is it like flying in the ocean or something like this? Unity catalog, is it some kind of catalog with a lake over there? And right now, Laura is feeling comfortable to discuss all of this because for her, it's also important. Without understanding the technology, she cannot match her capabilities and capacity for enabling the need of the patient, and she cannot explain to me and George what actually patient need, what nurse ambassador need, how the workflow is supposed to look like, and this is very important to keep aligned because this is Databricks is not a box solution, it's Lego builder. Bridging communication gaps, I guess this is pretty common and relevant for any type of enrollment for the big program, but what is critical over here and why I think it's critical for the program because of the previous steps of recent changes. You need to communicate on the daily basis internally, and this is very important because unfortunately rebuilding even in the microservice architecture will cost you time and cost you money. And sometimes changes are controversial to contradiction to each other, and then you need to move forward. As any team, we are facing tsunami of requests, where is our AI? You can imagine, I guess, each of you are feeling this pressure on the daily basis from your stakeholders, from your managers, from your directors, why there is so not much AI in my vertical. I want to have more AI. We are definitely not asking you to push back, but our journey over here showed that we need to be very precise with our decisions. Because right now, AI is something new, and people are thinking about AI a little bit like a black box, but this is not what it is, definitely. If you're talking about AI, we need to explain to them what is the price of the token, what is the percentage of the accuracy and how it works, what is the RAG library, and all the other things, because you can imagine we are working with patients. And enabling the nurse ambassador with the windows of any type of LLM solution, you need to reach the accuracy of 87, 90%, none less, because he or she or they will use this information into the real-time communication and do some recommendation according what LLM is showing them. Are we that far right now with the quality and the speed of data that was collected via calls and other things? Not yet. That's why, as a team, we are trying to leverage the capabilities of any type of Gen AI or AI solution very smoothly and smartly, and this is what we recommend to try to explain to your stakeholders. AI right now cannot replace anyone. This is what it is. Non-junior developer, because the lines of code will be not so clean. Non-nurse ambassador that are on the phone with the patient, none anyone else. We are strongly recommend to think about like augmenting the human instead of replacing. And whenever we are saving the time of the human to cover more work, to do it more interesting for them, this is what drives the platform pretty smart, and this is what we see as a good feedback from the platform. Free up your human time, because humans are great. Everyone who is working on our team, both from IQVIA and for Customertimes, as soon as they have more time, they are coming up with a nice suggestion and good ideas that are improving platform on a daily basis. So the power of combining technology, data, and human insights is what we see in our program. And this is what we would like to share with you. And definitely, we are absolutely ready to answer any questions around what you ask. Please follow the survey. And thank you very much for listening.